Hello and welcome. My name is Marcy Wiener-Lahav, and I am the Director of the Adult Services Department at the Betty and Milton Katz Jewish Community Center. On behalf of the Katz JCC, I welcome you to this inaugural special panel, Learning from a Distance, Contain the Spread, Things You Need to Know to Protect You and Your Family. It is now my pleasure to introduce Laura Nelson, the co-facilitator, director, and producer of this event. She is the New Jersey Director of Community Relations for the Rothkoff Law Group. Laura is often behind the scenes, but now you're going to see her in front of the scenes, up close and personal, and she gives you a tutorial on how to engage during this discussion.
Laura, we can't hear you.
Can't hear you.
Thank you. Hi, everybody. Sorry about that. My name is Laura Nelson, as Marcy had said, and I'm just going to give you a quick tutorial as to how to engage with us. We do have a rather large audience. We actually have approximately 150 people online here. So we are going to try and keep everybody's mics muted and allow you an opportunity to submit comments, questions in the question chat bubble. So go ahead and find that area. You can practice sending a message. For those of you that have dialed in and you're just listening, or you don't want to interact, you're here for just the information, that's totally fine. Another feature that you should be aware about is the fact that sometimes if you navigate away from the screen, your control panel will minimize and you won't be able to see the panelists. Look for either the little snowflake or flower button on your bottom of your desktop, or you can also look for this little orange arrow and click it, and that should bring all the windows up again for you, so that way you can engage. If by chance we do open up the mics for questions, sometimes our panelists take things in a different direction. I do want to bring to your attention that there is a little green mic button. Right now it's locked, it won't work for you, but if I do say, hey guys, I'm unlocking your mics, just keep in mind to lock yourselves up if you want to self-mute, so that way we do not have any interference with background noise. And with no further ado, I see a couple of questions have popped in, so I'm going to take my mic off again and pass it back to Marcy. Thanks for joining us today.
Hi, we're so excited to have you. As our state begins discussions on reopening, it is so crucial for all of us to be informed as we navigate our way through the conflicting media coverage. As the JCC is the host of this event, it's important for you to know that being connected is an essential ingredient in living a full life. When this is missing, consequences can be very real for both your physical and mental health. As we abide by the stay-at-home directive, living alone, as many of our seniors do, isolates them even further. The JCC is all about making connections for people of all ages and abilities. That is why we are online daily, connecting with you, presenting programs that enrich and engage. More info to follow. All of us, doctors, lawyers, social workers, are in this together in a continuum of care, providing to our older adults in our community. We are so honored to have an esteemed panel of experts from the legal, medical, and social service arenas today. First, I would like to introduce Jennifer Levy, President of J. Levy Associates. We are so glad to have you with us today. Thank you. We also have Rebecca Rosenau, Director of Senior Services from Jewish Family and Children's Services, one of my colleagues in the Federation of Agencies Serving the Elderly. So glad to have you today. Dr. David Condalucci, who I just met the other day and whom I could listen to forever, Chief Patient Safety and Quality Officer from the New Jersey Jefferson Health. We cannot wait to hear your responses today. Last, certainly not least, we have Dr. Lisa Drucker, Medical Director at Ascend Hospice. And the first time I met her, she was actually disinfecting herself. She is on the front lines and has much to share with us today.
Hello.
It is now my distinct pleasure to introduce our moderator for today, Gerald E. Rothkoff, Esquire, Managing Attorney at Rothkoff Law Group. He is so integrated into the older adult community, and we are so very honored to have you be our moderator today.
Thank you, Marcy, and thank you for everyone attending. I believe we're going to gather the panelists together now. All right, so we have an esteemed panel, and we do not have a great deal of time. We have 1 hour to talk about a topic we can be talking about for the next 24 hours. There's so much going on with both the social issues, the legal issues, the financial issues, the care issues, and medical issues, and everything else to get into. What I want to start out with today is this afternoon is really talking about, where we are starting from a medical perspective, because everyone is concerned about, for example, especially related to our local community, the JCC and extended community, is, when can we get back to life as normal? When can we get back to attending lunch at the JCC? When can we are our kids going to be able, and grandkids, are they going to be able to attend camp this summer in Medford, for example? So I keep hearing over and over again, both Dr. Drucker and Dr. Condalucci, that the key for any resemblance of normalcy, whatever that may be going forward, is the status of testing. So Dr. Condalucci, as an infectious disease specialist, can you kind of give us the lay of the land, specifically in our local community? What is going on locally with the state of COVID-19 testing in Southern New Jersey? Can you touch upon that and the importance of the testing going forward?
Oh, we've come a long ways in the past 6 weeks with testing in our region. For a long time, we really didn't have the tests, the different types of tests. And little by little, over the past 4 to 6 weeks, we now have the ability to do rapid testing as well as a more conventional type of testing. By that, I mean, one can be done quickly within a 15-minute, but it's not, it's only 60% sensitive. But on the other hand, you can also get the better test, which takes a little longer, sometimes a day or two. You can go to your local, if you need obviously you're going to need a prescription from your provider, but you can go to Quest or LabCorp to get that done. Or there are 3 testing centers that are available in the southern counties that you can go and get tested as well. I think we've come a long ways for that, but I just want to remind everybody that that only means if you're positive or negative, it only means that you are positive or negative for that moment. With this virus, it's kind of tricky. You can be negative today, and then tomorrow or 2 days later, you can turn up to be positive. But there really should be available to our community, and certainly in the hospital, healthcare workers, and in the nursing homes. You can get tested now and indeed know that you're positive or negative. I think the other question, perhaps maybe talk about it a little later or not, would be the antibody test. That's another depth to our understanding of exposure. And maybe I could take a moment to talk about that just briefly. Would that be all right?
Go for it.
So when they talk about testing, what they're really talking about is if you've been exposed to the virus or the antigen. What you need to know, though, is do you have immunity to this virus? Because if you know that, then you have a certain sense of comfort that you may now be protected. Obviously, that's not 100%. We don't know for sure that that's the case, but you can order an antibody test. In fact, just this week, you can get it in the major labs in our region, both in LabCorp and in Quest. And the hospitals will come online shortly thereafter with those tests. And what it'll tell you, at least, is if you've been exposed to the virus and you've developed antibody to the virus. It doesn't mean you're protected 100%. We don't know that. It may mean that. It probably does, but we're not sure for 100% yet. But at least with those two tests, you can determine whether you got it now or you might have been hit, you might have been exposed, and you've recovered possibly from it. And that's going to help us a lot in the future as we try to navigate through this pandemic.
Can I ask a follow-up question, Dr. Condalucci? It was just Mother's Day. And then a month from now, Father's Day is going to be coming up. And we saw all different things. Many mothers talk to their children via Zoom. Some did social distancing. And then Father's Day, same thing, another month from now. So what do you recommend going forward with especially if we have an elderly parent or maybe even any individual with pre-existing conditions? What do you recommend now with visiting what you saw on Mother's Day and then going forward over the next month, continuing through Father's Day and beyond?
Well, unfortunately, right now, we don't know everybody that's positive. This is such a unique virus that you have people that are asymptomatic that are carriers. And therein lies the problem, with opening up society. You really do have, at this stage of the pandemic in our area, you do have to maintain social distancing and wear a mask when you're out in public. And if you're going to have gatherings, they should be very limited. And particularly if you got vulnerable populations like what you're referring to, perhaps our elderly mother and father, they're very vulnerable. And so unfortunately, by Father's Day, you're not going to be able to open up society in the way that we did in the past. We're in a new norm that's going to continue for many, many months and beyond until we can actually assure that you have immunity or that we've been able to vaccinate our public. And both of those are a ways off. So to answer your question directly, for Father's Day, you have to be careful. You have limited exposure, not bring in outside people that you don't know are safe, and you're not going to probably be able to go out to dinner. I don't know by June whether that'll be the case. If you are, it's going to be very limited in that exposure. And personally, I would be very careful about doing that without knowing everybody that's there.
Thank you. Dr. Drucker, I want to go to you, and I want to talk about a very important issue that it's regarding our most vulnerable population, and that is our most oldest residents, those residents who are in assisted living and nursing home. And that's, you spent a great deal of your career in long-term care. So can you talk about, when Dr. Condalucci talked about testing in general and with the antibodies, can you talk about the state of testing in assisted living and nursing homes? Because there are many of those participating in this webinar this afternoon who their loved one is in some form of long-term care, and they cannot visit them right now. So can you talk about the state of visitation related to testing in long-term care for a loved one, as well as what the state of testing is currently in assisted living and nursing home, and what's the prognosis going forward?
Sure. So how when this all started, there really was very, very limited testing, and not everyone was being tested. And only residents that had fever, cough, sore throat were the only ones being tested in the very beginning of this. If we would have a resident that would spike a temperature and we were concerned, we would give them Tylenol, they would send them to the hospital for hopefully testing. They wouldn't have a temperature when they got to the ER, and then the ER would say, oh, they're fine. They don't have a fever, they don't have a cough, they don't have shortness of breath. They're older, the little change of mental status, we're gonna check a urine. Oh, they have a urinary tract infection, treat that, send them back to us. Only to find out as they continue to spike temperatures and start to develop hypoxia, like shortness of breath and low oxygen levels, we send them back to the hospital, and lo and behold, they are positive. That was in the very beginning, so we had most likely several residents that were probably positive, and we did not know because the testing wasn't being able to be done. Now, 6 weeks into this, we're so much more on top of who needs to get tested. Anybody from a facility, if they end up in the hospital, they are getting tested. If we're having anyone with any kind of symptoms in the nursing home, they're getting tested. Other nursing homes that I am going to, we are now testing everybody. And, the scary thing is, I had no residents in one nursing home. I think there's 170 residents. We had tested everyone, and we had 21 positives, totally asymptomatic, come up. So immediately we had to cohort all those. We had to change everything around, move patients to kind of keep all the positive people in one area, your negative people in another area, those that were exposed in another area. So it's been very, very tough, trying to keep the visitation to a minimum. Really only folks on hospice are able to come in, but their temperatures are taken. They're questioned about symptoms, where they've been. They're totally gowned up, masked up, gloved up, and they go to visit their loved one in limited times and only one person at a time, just to kind of minimize the contact to the residents. But
Let me ask you this. What would you say to a loved one, a child, on behalf of their parent who's a resident of Lionsgate? What advice would you give that child as to communication? What advice would you give that child is when you see, based upon the testing, that some form of that visitation restriction being lifted? Because we get 5-6 calls of clients a day on that. We're an advocate for the families and our clients who we can't visit, nor can our geriatric social workers visit. So what would you say to those families out there who are listening today, where they're concerned about their loved one? And when do you think that visitation restriction would be lifted, or at least amended?
it's tough to say. I think there just has to be much, much more testing to the public to know who in the public is positive. Again, there's so many asymptomatics out there, you just don't know. And if they're asymptomatic, they can bring that further in and infect their loved one. I just think we don't know enough or have enough testing to know that somebody is safe enough to come in and visit, even with a mask.
And actually, if I can add to that, the nursing homes have really been looking, and the assisted livings and all of our levels of care have really been looking to how we provide services internally, and to make sure that from a social isolation perspective, that our patients and residents are able to talk to their families routinely and have all the interactions with their care providers that might not be able to get into the nursing home because of these restrictions. So, we're very fortunate in today's age to have technology, to have Zoom, and to have telehealth, where where we're able to essentially have those communications both at a clinical level, but also at a social level. So when you're talking about having having residents visit with their loved ones for Mother's Day, Father's Day, and forward, work closely with the administration at the nursing home. You can reach out to the social workers, to the administrators, to the directors of nursing if you're not sure how to make those connections with your loved one. And they'll be happy to help you, facilitate that.
Unfortunately, I think this is going to be the norm for a while, that it's going to be a lot of FaceTime communications with their loved ones, unfortunately, unless it's a comfort care dying situation where an exception's made, and it's very, very limited. It's for the protection of everyone, unfortunately.
Jen, I know you're a consultant to long-term care providers. And let me just say this from a patient advocate perspective. I think we all agree that the best way our clients can get the best care in any form of long-term care is that it's a partnership between the family and the community. And now that partnership has been severed to a degree. You're right. Technology can help to build build that back together. There's no doubt, but it's limited for a variety of perspectives. So I think what I would look for as a patient advocate working with long-term care communities, as well as the state, medical providers, Department of Health and otherwise, is there must be a way going forward, because as Dr. Drucker just stated, we don't know, this is ongoing. We don't know, there's no end date right now. So I think that there needs to become some type of formula where we can address both the needs of families who are barred from visiting, as well as the concerns that the community, long-term care community has, rightfully so, and where we can address to accommodate both those needs to get the best care, which is the ultimate goal for all of us together. But let me go to Jennifer at the moment. Jennifer, when as you're a consultant on long-term care, can you address, and in many cases, specifically nursing homes, have been vilified in the press for reasons that's beyond the scope of the presentation today. And there's many reasons for that. I would argue that society has failed our most vulnerable residents as a whole. Monday morning quarterback will be after the pandemic subsides, so to speak. But what are we not seeing in long-term care from your experience counseling and consulting with long-term care providers and their staff? What are we not hearing in the press? The everyday struggles of Alliance Gate and communities like that. What is going on internally that maybe the average community member does not see?
First, I want to say that our providers in our long-term care and our assisted livings are also our unsung heroes out there. They come to work every day with heart, with passion, and really wanting to do the best that they can to provide care to all of our loved ones in a very trying and difficult time. For all of us, I can tell you that I don't think any of us have ever experienced this type of pandemic to this level that has affected every aspect of our life, whether it's on the medical clinical side to our personal worlds. So we're all trying to adapt as a continuum and as a healthcare community to figure out, what our new normal is going to look like, given the regulations and given, our want and desire to be able to provide the highest quality of care. So I can tell you many of our nursing home providers have really looked at their policies, at their programs. They've adapted new plans of care that really encompass new ways to assess, new ways to provide activity programming, and ways to partner so that we have adequate staff and the ability to have all of our different providers that provide services to our loved ones, like our psychologists, our psychiatrists, our medical consultants, up and above our attendings. Many of these nursing homes have cardiologists and nephrologists that come and also, round in these buildings. So they've put together, some of them call them, COVID, we now have like a COVID initiative in these buildings where there's a whole new programming level that they're able to provide to make sure that our loved ones have that care. But I can tell you they work tirelessly every day. There are administrators in many of these buildings that are there around the clock, making sure that our loved ones have the staffing, have the care, are getting, the resources that they need in a time where the resources are lacking. It's very hard to come by. Just like when you look in your, when you go shopping in your food markets or a Target or any of these different places, trying to get those items that you would typically be able to get easily have become much more of a challenge. So one of the nice things that we've seen is that our entire healthcare community, from the Department of Health, from the New Jersey Hospital and Healthcare Associations, as well as our providers, have really come together now as we begin to understand this virus more, and figure out what that normal is going to look like, so that our family members that place their and entrust their loved ones in our care start to have that comfort level back.
Thank you. Marcy and Rebecca, I would like to move on to you because you assist seniors in a community setting. Marcy at the JCC and Rebecca through Jewish Family and Children's Services. So one of the key issues is that, especially our seniors who are living in a home and community setting, is social isolation. They are isolated to their home, obviously. They cannot get out because, as the doctors already indicated, it's not currently safe to. So yes, there's limited out. They can go to the local ShopRite, for example, and there's senior hours, but many are still, with good reason, very hesitant to leave their home. So can we talk about, Marcy, related to social isolation, where normally you have hundreds of seniors coming to the JCC on a daily basis to participate in activities, socialization. So can you talk about what programs are currently available through the JCC, and then I guess methods that they themselves or a child can assist in order to relieve that isolation?
Absolutely. We serve 2,000 plus older adults, and my staff and I, in these few weeks, have probably reached out to 400 or 500 of them. And as a result of that, we've been able to glean what the issues are. And the Federation of Agencies Serving the Elderly, being JFCS, JCC, Olive, and Senior Housing, we all work as a continuum. So for instance, this morning, someone called me about meals. I referred them to Rebecca. So we're forever, you can enter at any point in time in our system, and we will, if we're not the right ones, we will refer to you. So things that we're doing right now, as Jen said earlier, we have to rely on the online platforms. And one of our largest barriers is that our older generation of older adults are fearful of technology. It's difficult for them to manage. They may have it or not have it. Some of our guys are living with their loved ones, so they're helping them. So we're trying to find all different kinds of ways to educate them, whether my staff and I are walking them through for the 25th time how to get onto a Zoom conference call, whatever. We're doing everything we possibly can. So what we've started to do is put a lot of our daily programming online. So that's anything from modified yoga, meditation, exercise, movie discussions. We're going to be having our annual volunteer recognition online. We've celebrated 102nd birthday of one of our clients, 101st of another one, and 97th of another. We're trying to find all different kinds of ways. As I said earlier, the JCC is all about connection. And like you said, Jerry, so poignantly, that especially older adults, many of them are already living alone. And a place like the community center was their second home, as many of them have said to us. They've come to us for decades. They come 2, 3, 4 days a week. They come to us for lunch. They use our transportation. They have case managers from JFCS, etc. So it has, and we have to go with the flow. Day to day, we talk as a staff, what else more can we bring? I met with all of my club leaders yesterday, which represented around another 500 members within their 10 different clubs. And the one thing they said is that it's going to take a really long time for their membership body to want to come back to any kind of facility, especially like the JCC, because of the congregation of people there. They don't want to get on the transportation. They don't want to be part of the congregate meals. And they say the one thing that you can do now is to continue connecting with us. What happens when I teach a class every other week with them, 30, 35 of them come on board and they can see one another. And each time we try to teach more and more of them to come and join these classes because they network with one another, they network with us, and they share with us their needs. And then we do our best the next week as we go with the flow to try to meet those needs as they come up.
Thank you. And it's interesting because one of the things I think, and we'll talk about some of the good, because there is some good here, believe it or not, through all the bad. There is some good that will come out of this, and we'll try to end on a bright note, nonetheless. And one of the good you just talked about, Marcy. Now, a lot of our seniors, possibly due to transportation in our area, are not able to get to the JCC at all, or at least on a daily basis the way they would want to. So some of this distant learning certainly can be continued thereafter, and we'll talk more about that over the next half hour or so. So Rebecca, I want to move towards you now. With regard to what you're head of senior services, so that's a very important position, especially in today's world, in South Jersey. And by the way, you do a great job doing it as well. But let's talk about some of the issues related to social isolation again, and specifically, a lot of seniors, it's dealing with, unfortunately, it's not only seniors, but food insecurity is a big issue today, isn't it? Especially with your clients. Can you address some of those issues and how JFCS is responding to some of the issues relating to food insecurities and some of the other important issues that you're dealing with, that you're seeing with your senior clients as well?
Absolutely. So to discuss food first, since we know food is an important topic for everybody, regardless of their age and abilities, the Jewish Federation has put together a new program effective mid-March due to COVID entitled Shop and Drop, whereby any senior or vulnerable individual who is trying to stay out of the grocery stores, they can merely call or email the Jewish Federation to ask for a volunteer to do their food shopping for them and to literally drop it at their door. There is no extra cost for the service. It is asked that one is able to pay for the cost of their food, just like they would at the food store. However, if somebody is unable, we will work with them as a social service agency to assist them with their food expenses. As part of that, JFCS still has a mobile as well as an existing concrete food pantry, the main food pantry being located on Route 70, whereby our dedicated volunteers and staff are providing food deliveries from our food pantry for both existing clients as well as the community at large, as long as they're in our coverage area, which is basically the Tri-County region, Camden, Burlington, Gloucester County, surrounding our offices. That being said, a longstanding program that has also really grown as a result of the food needs is our Catered home delivered meal program, which is through Betty the Caterer out of Philadelphia, whereby one can order frozen meals that are made to order with more than a dozen meal options, ranging from vegetarian to meat and poultry or dairy options, whereby for $7 each, they can get meals delivered to their home, again, largely by the volunteers of the community on a weekly basis or as needed. There's no eligibility other than being able to pay for them. However, we also have connections and collaborations with the county. Specifically, Camden County has moved their meal program, whereby anybody who previously came to the JCC for the hot lunch, they are now also able to connect with Camden County to receive free home delivered meals. And again, we're working closely with them, where somebody, if they require kosher food, we can work with them to ensure that that person gets the food that they need. So food has been something that we have received hundreds of calls on a daily basis, and I think it's working fairly seamlessly, and we welcome people to call on behalf of a loved one or themselves if we can assist. Just to segue a little bit, because outside of food, the topic of social isolation is really, of course, continuing to impact the clients we serve and the community at large. The individuals who had some form of emotional health needs before, whether it's related to anxiety or depression or loneliness, those needs have only become greater. So the individuals who were previously receiving counseling on a monthly basis or bi-monthly basis, for the large part, are seeking it more often. And as Jerry referenced, there are some good things that have come about as a result of this pandemic, whereby insurance companies are allowing telemedicine, where we can be meeting with our clients through a secure system, through Doxy, or if the client merely has a smartphone and they're comfortable using FaceTime, we will meet them where their abilities are. And ideally, we can see them weekly or bi-monthly to provide that emotional mental health counseling, whereby for many seniors, Medicare and a secondary insurance may cover in full or in part the coverage of their counseling. An additional benefit is that many insurance companies are currently waiving copays during the time of COVID, and that is something many people don't know. Similarly, it's really up to the individual to ask their insurance company, as it may not be offered to them if they don't ask to inquire. Additionally, our support groups continue via Zoom. So whether it's for caregivers, for those who are bereaved, for Holocaust survivors, for those with loss of vision, we are providing phone support for our Memory Cafe and our Aging with Pride LGBT. One final thing to mention is that in response to the needs of the community, we have created a coronavirus grief and loss support group, which is scheduled to start this month in May, free of charge to anyone who has lost a loved one due to COVID. So we just want to ensure that everybody knows that we at the Jewish Federation, specifically JFCS, we are here to support you in the safety of your own home through the phone or technology, and we're just a phone call away.
Thank you. And Rebecca and Marcy, it's my understanding at the end of this webinar, all of the information is going to be posted. Websites, reference information, the shop and drop program, every program that you just referred to is going to be referenced. So our audience will have those websites and that information, and they can log on. But Marcy and Rebecca.
Actually, I just wanted to interject that actually they're not going to be posted. I'm actually going to be sending them to all of the attendees who attended this panel today. So they're going to be getting that in an email.
Thank you. And by the way, my apologies. Since we're by technologies. They picked a fine time to start mowing the lawn. So if you hear something in the background, it's the lawn being mowed. But it is what it is. You got a dog in your lap, you got a baby crying, dog barking at the mailman. It is what it is, right? We've all seen that on Zoom. So Rebecca, let me follow up though. Now, and Marcy, a great deal of what you talked about is only done through volunteers. So some people are out of work, and like my kids, who should be in college right now on campus or just finishing finals, they have some extra time on their hands. So what if anyone out there listening, either themselves or one of their family members wants to volunteer? Are there volunteer opportunities available, and where can they get in touch with the right person to volunteer for some of these programs that you referred to?
So absolutely, I know that Shop and Drop is still advertising that they would benefit from having volunteers. The other thing I know individuals as well as groups are doing are they're collecting non-perishable food that can be dropped off to the food pantry, because despite the excessive donations that have been coming in, there's still greater need. So those are two options with respect to food. With a third in respect to food is food deliveries. As mentioned, with the frozen meals on a weekly basis, there are weeks that we could be in need of more volunteers. I welcome anybody to call JFCS or the Jewish Federation if that would fall in interest to them. Another thing I know younger children or teenagers may be interested in doing is writing cards or drawing pictures. There may also be opportunity to call vulnerable seniors or individuals who are isolated at home, although I do know we have a large number of volunteers who are already doing that, and we have to be safe with respect to giving out individuals' private information. So the biggest area of volunteering right now is probably in the realm of food, from my standpoint.
Yeah, and I was shocked, and I saw a picture, I think it was on Facebook, because I think the Cherry Hill School District opened up, provided free meals, and they're at I believe it was Cherry Hill East High School. And I was shocked when I saw on Facebook, there had to be at least a mile long, I haven't seen it lately, but a few weeks ago, a mile long line of cars waiting to get a free lunch. And that tells you a lot. And so bottom line is those food insecurities are out there, whether you know it or not. So it's real. And thank you for pointing that out. Dr. Condalucci and Dr. Drucker, I want to kind of move on to where we go from here. Like anything in life, it's a balancing act. You know, it's a risk utility analysis, no matter what we're doing, including opening up, the state opening up. And right now, I understand it, parks and golf courses are really what's open today. And some of that is, some people question the validity of opening those up, at least some of the medical experts. So where do we go from here, Dr. Condalucci, with regard to opening up? And how do we balance those competing risks of keeping individuals safe, keeping that social isolation going, but also preventing that depression related to that social isolation? And how do we balance science from real life and everywhere in between?
Well, it's a difficult question, but we do have to be able to begin to adapt to a new norm in our country, because it's going to be that way for a long time. You know, one of the things in healthcare that we've found is we've not had elective surgeries, you know, in a long time in all of our hospitals. And it's just recently that that's begun to, you know, be put on the docket, because a lot of people have gotten seriously ill because their surgeries have been delayed, which otherwise would have happened. And so we have to begin to open society, but we're going to have to do it very carefully. People have to be respectful of each other. The masks are, you know, not only for the individual, but it's for the protection of everybody else. And people are going to have to wear masks if they're going to be out there in the community, because you have to protect our other fellow citizens from any exposure of droplets and aerosol, that this virus is so contagious. Parks and places like that, you know, generally are much safer when you're outside, but you have to maintain a certain social distancing of about 6 feet or so in between. So that's why they're beginning to open up some of those, you know, parks and recreational areas, because they're the safer places for people to begin to get out of their homes and congregate. When you start talking though about restaurants, it's going to be much more difficult. You know, you can't pack people in restaurants and bars at the present time, because that increases the likelihood of another, you know, we call it like a popcorn effect, where you're going to have these episodic outbreaks of where people have congregated. And so that the state and local health departments and the government's going to have to keep a close eye as they open up, to make sure that we don't let this thing get out of control. We suspect it'll probably be less in the summertime, but as we head into the fall, we are likely to have, you know, increased activity because of the flu, and because at that point we will not have had a vaccine that will be available to protect people. So unfortunately, this summer and into the fall of this year, for sure, it's a new norm, and you're going to have to learn how to navigate that in a way that has social distancing, sanitizing your hands frequently, wearing a mask when you're out in the public, and have a situational awareness where you're aware of your own situation and that of others, so that you don't unnecessarily put people at risk. Particularly, the focus today here is on our elderly, and they are very much at risk.
So when you say out in the public, and Dr. Drucker, same question to you, you know, 6:30 in the morning, I took a walk this morning, you know, went around. Should I be wearing a mask? Or, you know, when I take a jog or riding my bike, I may be around people. I try to, you know, one of the interesting people is like, you know, we all deal with this when we're walking in our neighborhood now, and there's two people that are colliding together. It's like, okay, who moves first? Who goes to the other side of the street? You know, so it's kind of like a mental telepathy. But so to a certain extent, it's a whole new norm out there. But I mean, when you're out there riding a bike, jogging, even when, you know, with open sidewalk, should you be wearing a mask?
I think if you're alone and no one's with you, or you're with the people you live with, I don't really think it's necessary, but you should have it with you in case there's encounters. You know, walking along the sidewalk, I know, you know, the supermarkets have, you know, the aisles, you can only go one way. I just kind of stay away from everyone. You know, if I see someone coming, I always move out of the way and allow them to pass, or I just go in an opposite direction just to avoid it. I just think it's going to be a whole new norm and a whole new respect for others as we go through this. I think everybody's going to have to be patient. I don't think if, you know, if you're jogging with a whole bunch of strangers, I just don't think that's a good idea, because jogging with a mask can't possibly be healthy for you. You know, there's not good oxygen exchange and whatnot by doing that. I think if you're going to exercise, it should be either alone or with the people you live with. And just try to be respectful of others when you're walking on the street and you happen to both be on the same sidewalk. You know, I will just turn and I may go sideways if it's that close. I try to avoid that situation altogether, but I just think it's a mutual respect at this point amongst just the community.
Let's move on, because we only have about 10 or 11 minutes remaining of the hour. So I want to talk about some of the good, some of the lessons learned, and as to over the past 2+ months. And one of the good has come out of that you're talking about jogging and walking in the neighborhood, is that people are very friendly. I mean, people that I would probably never say hello to or wave or smile at, you know, and vice versa. Are everyone saying hello, waving? I have no idea who they are, but that really doesn't matter. People are very friendly, and seeing families play together in the front yard that, you know, granted, maybe they would be at work, or, you know, they would be at soccer games or whatever the case may, baseball games on Saturday morning, whatever they may be. But it's great to see families actually playing together. Maybe forced to play together, but it's still nice to see anyway. So that is some of the good that you see, that you know, things that families are spending quality time together. Whether that's good or bad, I'll let each family judge on their own. But Jennifer, let me talk about the long-term care consultant. Talk about lessons learned. What lessons has the long-term care community learned that can reassure families going forward, that they will carry forward? You know, maybe the environment needs to be changed in long-term care communities, because and 2+ people in a room is probably not very good in a positive way for dealing with the COVID-19 crisis. Can you talk about what lessons that long-term care communities have learned and where we go from here?
Absolutely. And, you know, remember, to your point about the double rooms and whatnot, many of our nursing homes that were built 30, 40, 50 years ago and have adapted to the changes in healthcare over the years. So, you know, when you look at that, you do have patients in double rooms, some even in 4-bedded rooms. And over the last couple of years, when we've looked at other challenges to our environment that have come along, like Hurricane Sandy, for example, we've all prepared with the Office of Emergency Management and the Department of Health on how do we respond to those types of emergencies. You know, how do we evacuate if there's a fire, God forbid? You know, how do we care and provide care in place, you know, if there's an active shooter? But one of the things we never really focused on was how do we provide care in a medical pandemic like we're dealing with right now. So some of the positive that has come out of it for the nursing homes and the healthcare industry is we have more stringent infection control focus. You know, we will be better prepared in the future in terms of what type of personal protective equipment we need to keep on hand at all times in our community, in our nursing homes. You know, for other emergencies that are out there, we know we have to have a certain amount of water on stock at all times. We have to have a certain amount of linens in the building at all time, and food, you know, at all times. but we never really thought about the masks and the gowns and, you know, some of the other PPE, as we call it, that need to be on hand. We also have looked at a more stringent and education to our staff so that they too are better prepared as it relates to infection control. So, you know, we're starting to see that, you know, you're going to see our programming, our staff, even the education level of our staff and what they're learning. Most of our nursing homes are manned by licensed practical nurses, a little different than our registered nurses from an assessment level. So now it's really pushed our LPNs which basically make up most of our staffing in our industry, you know, to step up a little bit and to learn and to, you know, even based on license, you can't always assess, but to be able to, you know, change the way they critically think a little more and, you know, be able to communicate differently and to our physicians so that the physicians are getting accurate and a picture of what's going on with the patient when they can't always be there one-on-one with the patient. I don't know, Dr. Drucker, if you have any insight into that you wanted to add as it relates to the interactions with the staff in the building from a medical perspective.
Oh, absolutely. The nursing staff definitely needs to and has stepped up quite a bit to improve their critical thinking, to improve their assessments, to know what they're looking for, to try to stay ahead, to be sure that we get ahead of problems before there becomes problems. They definitely have taken on a much different role now, just passing out meds, taking vitals, and writing their monthly notes. They're now basically charged with, you got to check on these people, you got to let us know right away what the issues are, and they need to know what they're looking for. So that's a whole other education that they're going through and learning all about as their roles change now.
And I would also say, Jerry, one other quick thing is we have other clinical pathways that have been put out there for suggestive heart failure, et cetera. And now there's actually pathways that have been put out for the care of COVID positive patients in these communities, which is really important. So they're looking at frequent respiratory assessments in the buildings, and, you know, looking at standard hydration related to COVID positive patients. You know, how IV fluid is administered, you know, when these types of patients are in our building, and really looking at restorative eating and whatnot. So there's actually many of these facilities have put in a COVID positive clinical pathway to make sure that these patients are getting the care that they require based on their diagnosis.
Yeah, I definitely think there's going to be more state oversight. And I guess one of the issues beyond the scope is who's going to pay for all that? And that's a very important question. And I don't have the answers. And that's maybe we'll tackle that in the next webinar. But I mean, the cost structure is going to significantly increase given what you just said. I think that's a fact, and we all have to acknowledge that, both the communities as well as consumers, the public needs to acknowledge that. I don't have an answer to that. But Marcy and Rebecca, before we end, let me get back to you because I want to talk about the community again. What lessons have been learned? What lessons has the Federation learned? What lessons have the JCC learned? What lessons have JFCS learned? And what can you see continuing going forward that can really benefit our community as a whole, regardless of a pandemic or no pandemic? Marcy, let me start with you from the JCC perspective.
Well, we have learned that older adults can continue to learn, and they can learn technology, and it will help them so much in their lives, communicating with their grandkids, their children who are out of state, etc. And also, they don't come to the center or anywhere if it's inclement weather, if they're not feeling well. This way, they can plug in, they can go to their favorite class, they can do their exercises with their friends online and continue to be connected when often during the winter months we see less of them. You know, they have a tendency to be more depressed and perhaps, you know, get sick as a result of not really eating properly because they're not coming in and congregating, etc. So I think it's really, they're so excited when they learn how to connect. And this is going to be the new wave, because as JCCs are opening across the country very incrementally, the first wave is not going to be the older adults. We're going to learn from those new openings because older adults are going to be more fearful, and understandably, because they're being more targeted by this virus and they're more scared. So they may not be physically in the building, but we are going to be able to still be there for them. We're accessible by phone, by email, by Zoom, by anything they want. And I think that that has been the most positive. We have one woman who is stuck in Florida. I'd rather be stuck there in some ways, but nonetheless, she's joining in because we have classes she wants and she can see her friends. So I think that is, and the JCC, it's all about, in the Federation building, it's all going to be about the health and the welfare. Before we open our doors, we meet with the Department of Health, we're meeting with CDC, we're going to do all the guidelines, we're going to do it incrementally, and eventually, and in learning so, we're learning how to be more cooperative with our colleagues in the building, networking outside, working together within the JCC Association, and helping one another as we learn and go forward.
Thank you. And Rebecca, from JFCS perspective, what lessons have you learned, and what do you think can be carried forward to assist your clients?
So I agree with everything Marcy said. We're seeing the same thing in terms of our clients surprising us often in terms of their ability and willingness to try new technology, whether it's the iPads that have been donated to them and now they're FaceTiming with us as well as their family from around the world. But additionally, JFCS already provided at least 50% of its services to seniors in their own homes due to limitations with transportation or physical mobility and the like. So that has only expanded and will continue to expand, it seems, from the current times and going forward in terms of being able to provide those in-home services, sadly likely not in person at this time and for the foreseeable future, but via technology. I think one of the things we'll continue to try to figure out is shared workspaces. That has been an ongoing struggle, and now even more so in terms of multiple staff sharing an office, or in the case of meeting face-to-face with our clients, which surely we hope will happen again in time. The question is how to do that safely. So I will say, honestly, we are still very much in the learning phase, but number one is health and safety of our clients, of the community, and of our staff, as well as volunteers, so that we continue to meet the needs. This is new to all of us, and we're continuing to figure it out.
Well, to wrap it up, I mean, it's 1 o'clock, and I don't think any of us have all the answers. That's why we're doing these presentations, to share knowledge between ourselves as well as the public, because this is all new from whether it's a medical perspective, a business perspective, a long-term care perspective, a community perspective. And we're, as many of you heard many times, we're in this together, and shared knowledge is the way to get through it together. And so thank you all for participating. And this is just one of many future presentations to inform the local community what is going on, both from the JCC perspective, long-term care perspective, and medical perspective, and keep people informed. Knowledge is power, and this is a start of an ongoing conversation. So thank you. This is a very informative hour. I thank you all for your participation. And Marcy, as the host this afternoon, I'm going to turn it back to you. Your silence, Marcy.
Oh, I was just unmuted. I want to thank you, the moderator extraordinaire, and I would be remiss in not thanking Jen. This was her idea initially. We have to applaud her for putting this all together. Because of the overwhelming response, I do believe, as Jerry just said, that I think we're going to continue the conversation, maybe call in some new people, etc. And I want to thank our heroes who are on the front line, and those of us who are supporting and counseling and engaging from the back. And I was told to put a little plug in as the hosting agency. Tune into J-Town TV on the CATS JCC website to continue to learn and grow and engage and stay active and to learn more. And I would love to have the doctors come when we are back on site to come and talk to our population. I can't thank you all enough, the attendees, this wonderful panel. May we meet again. Stay healthy, stay well, you and your loved ones. Thank you.
Thank you
Thank
all.
Thank you.
you.
Stay safe.